Maria Holder Diabetes Center.
Managing diabetes means treating the whole patient, not just blood sugar.
Not 5, not 10,
not 12 and a half.
but get ready for 15 diabetic friendly minutes on VOB, all with the compliments of the Barbados Diabetes Foundation.
We're ready for us to hear what happened in today's show.
In today's show,
I want to get a little bit into kidneys.
you heard Dr. Diane Braffet. I will let you hear it again.
I want to get a little bit into kidneys.
Today, Dr. D talks about your kidneys, what your kidneys can do for you, or what you can do for your kidneys. An exclusive kidney interview with Dr. Diane Braffet. All this and more on today's show with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that can get you ready for any financial issues you might encounter. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic, or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center.
A happy Saturday morning, VOBers! Peter Boyce here. How is everybody doing this morning? You might be hearing how the price of oil might be going up and it might have you worried, stopping you from sleeping at night. In these kinds of times that we are living in, it is even more important that you look after your health to make sure that you don't get run down, especially if you are diabetic or pre-diabetic. Make sure and look after yourself by making an appointment with the Maria Holder Diabetes Center, located in Warren St. Michael. There you can find top-notch diabetic services like dietitian Victoria Cox to give you some good, healthy, nutritional advice on what you should be eating so you don't end up eating yourself into an early grave. You can also find vascular screening. You notice how your ankles have been swelling up recently?
Yeah, I just gotta keep my foot proper all the time.
Well, if you feel you might have bad circulation, maybe it is time for you to make an appointment at the Maria Holder Diabetes Center and get a vascular screening. Plus, they have diabetes specialists like Nurse Tracy and Dr. Diane Braffet, who specializes in so many diabetic issues, it will make your head grow. And then she can tell you why that's happening. So now you are going to hear from Dr. Braffet to especially focus on your kidneys. So we welcome and say good morning to Dr. D.
Hello, good morning. Happy Saturday to everybody again. I hope that you all were able to learn something about glaucoma over the week that went by, and also to maybe take in some of the activities. Remember, the webpage is Barbados Glaucoma Week if you want to go back and see anything that happened or review any recordings or information that was there. How many of you knew that Thursday, March 12th was World Kidney Day? So for this week, we've also been celebrating or acknowledging World Kidney Week in Barbados. There are a lot of ongoing things, a lot of ongoing activities that can provide you with information. There is a concert coming up, a fundraising concert. So please go to Barbados Kidney Association, have a look and see what's going on, okay? Now, I want to get a little bit into kidneys since that's where we're at right now. And I'm going to just share some just basic information with you about kidneys. So first of all, your kidneys, they're really important organs and they're main job is to filter blood every day of waste, and in that filtration process it creates water or urine that comes out, and the waste is in the urine. Okay, but other than just maintaining what I'd say like a proper waste removal system, the kidneys do so much more. Okay, so they also are going to balance out things like fluid and electrolytes. So in other words, they help to maintain what we call the body's kind of like hydration status, and it controls the amount of water and other salts or minerals that are in the body, such as sodium, potassium, phosphorus, calcium. Okay, so when you have significant dysfunction of the kidney, some of these things can become out of balance. So the kidney is very important. What else does the kidney do? The kidney is critical in maintaining blood pressure. Some people don't know that the kidney actually produces substances. One of those is a protein or enzyme. It's called renin, and it actually helps to maintain the blood pressure. It causes the vessels to either squeeze or relax, and it also helps to maintain the sodium levels as well. So the kidney is critical in blood pressure regulation. Okay, so when we see people who have disturbances of the kidney, if they didn't have high blood pressure before, they may find that they develop hypertension. The kidney is also very important in the production of red blood cells. There's a hormone produced by the kidneys. It's called erythropoietin, and erythropoietin is actually the main hormone that stimulates the body to produce red blood cells in the bone marrow. Remember, red cells are important for carrying oxygen all around the body to all the organs so that the cells can live and be healthy. It is also very important in helping us to maintain strong and healthy bones. It's involved in vitamin D and calcium metabolism or balance as well. So basically what the kidney does, the main thing it does is it converts vitamin D into an active form, from an inactive to active form, which helps us to maintain bone strength, basically absorb calcium, put calcium down in bones, etc. And then of course it's also responsible for maintaining what we call the acid balance base of the body. So everything in the body operates at certain levels of what we call acidity or alkalinity. Any of you who've done chemistry will know what I'm talking about, but just think of it this way. You know, it's like if you have like an orange, it's like acid, so it's like almost as to how acid your blood is, and the blood can't be too acidic, otherwise it can't function properly, the cells can't function properly. So it helps to maintain proper acid levels. What more do we need to know about the kidneys? Okay, so when you develop kidney disease, it's called chronic kidney disease or CKD, and I would like to say kidney function is graded. There's a system for grading it, and there are 5 grades, 1 through to 5, with 1 being the most mild, 5 being the most severe, or 5 is end stage kidney disease. Okay, now remember, as we get older, kidney function naturally declines. So you may find that, you know, as you get older, you may fall into a grade 1 or a grade 2. However, we don't consider usually clinically significant kidney disease in the absence of proteins if something called the EGFR, which is a measure of how you filter, how the kidney filtering system works, is above 60. Okay, so remember I mentioned in the absence of proteins. Now when we are checking the kidneys, we therefore check the urine for protein levels, and sometimes we measure the proteins, and other times we will measure the albumin. It's actually recommended that you measure something called the albumin to creatinine ratio. I like to do it on a midstream urine specimen because if the urine is contaminated, otherwise it can be falsely elevated. A midstream urine, that just means you pass a little bit of urine into the toilet and you collect some from the middle, and that's the sample that you use. And we'll normally recheck the urine more than once because there are several things that can make protein appear in the urine other than kidney damage. So we normally check it on more than one occasion, and we say that we consider it to be positive if it occurs on at least 2 out of 3 checks spread over time. Okay, so usually it's separated by a few weeks or a few months or so. So 2 out of 3 checks. Alright, so that's why your doctor probably will advise you that you need to repeat the test. And then you have the blood test, and we look at both urea and creatinine, but creatinine is really the one that determines the level of kidney function. So that's a lot of basic information on kidneys, but I believe that people should know how things work. It almost gives you like a better picture, a better visual, a better understanding as to why these 2 little organs that sit in the back of the abdomen next to the spine are so critically important.
Thank you, Dr. D, Dr. Diane Bradford. We will be listening out for you coming back next week for part 2 of your kidney focus as we go into our Saturday song of the day. And since the focus is on kidneys, I will go into a song that I bet you never hear yet on VOB. Put in some humor into your Saturday morning. This is I Have Got 2 Kidneys. Compliments the Maria Holder Diabetes Center and Republic Bank.
I've got 2 kidneys, and I'm told I only really need one to really do all the stuff that kidneys do. The other kidney's just a backup. In case one of my kidneys goes down, I've got one in reserve. If I ever have a friend who needs a kidney, I'll dig right into my stomach and I'll pull my kidney out and say, here you go. It's because I'm a nice person and I'm very generous. I was kind of exaggerating. I wouldn't dig into my own stomach. I would have a doctor do it. But the point is, I got 2 kidneys, and if someone needs one of them, they can have it. I share my kidneys with people who might need them because I'm a generous person.
Alright, just to be clear here, we are not telling you to give away any of your kidneys, alright? We'll be right back after this.
The Maria Holder Diabetes Center.
I didn't know nothing about ulcers at first, but when I do find out, I guess it come from where I was working with safety shoes, and I didn't know I was supposed to wear safety shoes at the time because I carry seated toe shoes. So there I finally had it, but I didn't know. So when it did get bad, I've been to the doctor. When I get to the doctor told me I have to go straight to the hospital. When I get to the hospital, they're admitting me, so they monitor me, and then they come and told me I have to get the tooth off because the foot infected. I tell her okay, and they claim now that the blood was not flowing to the foot, so eventually have to get the foot amputated from a little above the ankle. I told her no, I don't want it. A girlfriend of mine come and look for me. She told me, ask my discharge, she gonna release me and carry me to a herbalist. I been from there, but when I get discharged, she sent me to the clinic, St. John. They wasn't doing nothing, it's in the progress, so I was between the clinic and my herbalist. So then a girlfriend didn't see me at church. She told me about this clinic here, down here. She make an appointment for me, and I come to see Dr. Bradford, and it went from there. It's going a year now I was here, and it get real progress. Right now, I will admit anybody to come here. These people here is very nice. It works for me, it works for anybody. They saved my feet, and I'm proud of it. The honest truth. And I thank them very much for what I see, and I will continue till eventually I get better.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Lifestyle changes can be just as powerful as medication in controlling diabetes.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you.
Holder Diabetes Center.